Hello everyone, I'm Asmita, a D-Life certified metabolic health consultant. I have with me Dr. Aparna Kulgude to review D-Life course. Dr. Aparna is a MD in homeopathy. She has been practicing as a homeopathic consultant for the past 20 years. She serves as a professor at a homeopathic medical college in Mumbai, where she combines academic expertise with clinical experience to guide future practitioners. Beyond her medical profession, she is a certified heartfulness meditation trainer and a cognitive brain development trainer. Dedicated to fostering holistic wellness, she is expanding her focus on integrative health. She now also has got the certification as a metabolic health coach, and she is helping individuals achieve balance and vitality through lifestyle and wellness practices. You have a very extensive bio, Dr. Aparna, and I would love to hear your experience as a newly certified metabolic health coach from D-Life, which is helping you combine your earlier medical training with a holistic background achieved through nutrition learning. So, what made you study low carb nutrition and why did you opt for the D Life course in low carb nutrition?
Okay. First, thank you, Asmita, for calling me for this review. And thank you for this wonderful introduction also. Regarding my introduction to D Life, I got introduced to D Life through one of my friend, Dr. Gopal Irony, who is now a leading metabolic health coach. Once we were discussing about my mother's case, who is diabetic since last around 25 years, insulin dependent diabetic patient. And he suggested me the life protocol. Slowly, I started this protocol on her, and I found that her HbA1c, which was there around 7, about 7.5 always for last about 10 years, and with medications, still it we were not able to reduce it. And with this D-Life protocol, I found that it is reduced to around 5.7 to 5.8,
Wow.
and it
Wow.
was consistent for about 6 months. I was very happy that this is like miracle for us, because we never saw her so energetic and so healthy without any infections since last many years, and this impressed me a lot. Then we used to discuss about the case, and after 4 or 5 conversations, Dr. Gopal said, "Now it's enough. Now better you join T Life. You study on your own, you learn, and now you will handle your mother's case. I will just be there." Then I decided, yes, now whatever he has told me, he said that it is just a tip of an iceberg, and now I have to fathom D
Mm-hmm.
life more. And then I decided. And then I gave this thought to me. Last 25 years, I have not made any value addition to my medical education
Mm-hmm.
apart from a diploma course in yoga. I didn't learn some anything new. So, and see, be it a homeopath or allopath or doctor of any pathy, our advice to our patient is just like, especially diabetic patient, is just limited to stop rice or reduce rice, no sugar, no sweets, walk regularly, take your medicine, something like this. That advice doesn't go beyond that. Many doctors nowadays refer diabetic patients to dietitians. So, more or less, the advice is limited to this only. And one more advice is given, that eat at intervals. Okay. So,
Hmm.
when I was thinking deeply about this, I thought patient is eating at intervals, not to go into, so that he should not go into hypoglycemia. And then he's taking medicine. So basically, so that with medicines he should not go in hypoglycemia. And again, if sugar is increasing and he is taking medicine. So this is becoming a vicious cycle which one needs to break
Yeah,
somewhere.
basically, he is living to eat medicines.
Yeah. Yeah.
Mhm.
And since 25 years, she's eating medicines and she's not getting better. Medicines are not getting reduced. So something should be done. And that's why I decided to join D Life. So this is in short about my introduction to D Life and joining D Life. And much before I joined D Life,
Mhm.
because of Gopal insisted me, and I to create awareness in students and upcoming doctors, I arranged one session in my institute.
Oh, nice.
And Ira and Gopal agreed to come. And to my surprise, the whole army of D Life was there. Anup sir was there, Manda sir was there, everyone was there in my institute. And their appearance was so impressive, so simple and down to earth people. See, now what we see D Life is, it is at that, now we know the level of D Life. And
Mhm.
getting these people at my home ground was a big thing for me. And
Mhm.
their conversation with our students, it was so like students liked it so much that I fallen in love with D Life, and then I decided to join D Life.
Yeah. So, as you said that because you are a meditation practitioner as well as you have a certification in yoga as well, so uh, and combining that with the holistic nutrition that D-Life teaches, so you are actually empowered for giving a consultation for the holistic wellness coming from meditation, yoga, and this background. So, how is this entire knowledge that you have helping in your consultation practice?
Okay. I was using my yoga consultation and even homeopathic medicines I was giving, but still I was not getting 100% results. Patients were getting better, but
Mhm.
whatever was required was I was not able to achieve. And
Mhm.
in homeopathy, we have a concept like obstacle to cure.
Mhm.
That obstacle becomes one of the maintaining cause. And after
Mhm.
joining D Life, I understood that diet is one of the obstacle in cure of the patient. Even
Mhm.
if I'm giving the perfect medicine, even if
Mhm.
I'm giving the perfect exercises or yogasanas, still
Mhm.
why patient is not getting recovered fully. So then I realized that yes, this is the obstacle to cure, and which
Mhm.
I need to remove from their lifestyle. And this
Right,
is
right.
how now it is like become holistic treatment from my side for my patients, and I'm very
Very
happy.
insightful point. Excellent. I learned something new today from you. The obstacle to cure is a very new concept that I learned. Great.
Yes,
So
yes, that
having
acts as
come.
a maintaining cause actually. It
Mm-hmm.
is there. Like if patient is having right shoulder pain and if his job is like continuously moving, so that
Mm-hmm.
movement acts as an obstacle. So we need to remove that. We need to tell the
Right,
patient that to take rest.
right.
It hastens the improvement. So similarly, this change in diet in
Hmm.
patient's lifestyle, na? And one thing we call all these elements as lifestyle disorders. So
Right, right.
definitely they will be cured only by lifestyle modification along with medicines, of course.
Yes, yes. Very interesting point. So, having completed the course, what are the things that have impressed you most?
Okay. First of all, the people in D life, they impressed me, and then I joined D life.
Mm-hmm.
Secondly, the course content, so vast, so deep. I didn't remember, and I asked many of my friends also who are in conventional practice, allopathic practice, about the concepts of nutrition. But the concepts which are given here, nowhere they are covered in medical education.
Right.
So this is
Mm-hmm.
something great thing I came across. Plus the research papers and case handlings where different cases are given, various recipes are given. So that course content is really vast, comprehensive, and very systematic. And
Mm.
it develops curiosity in you. Oh, this is given this in this chapter. What will be the next thing which I don't know? So this is out of curiosity, out of necessity. I went through the course, and I found it very knowledge giving and very practical things. Practical tips are also mentioned at various
Mm-hmm.
places during the course. Plus the quizzes are there. So like, am I doing well? Am I like absorbing the things? So
Mm-hmm.
quiz helps you to know where you are.
Yes.
That's very interesting.
Great, great. How do you find the support at D-Life and the resources which are biggest in the world? The forum and the community and the recipes and everything.
Yes, the community which I got here, I don't think it's
Mm-hmm.
anywhere. People are
Mm-hmm.
so empathetic.
Mm-hmm.
They understand. It's not like that you have finished the course or you are during the course. They never leave you alone.
Right.
You drop a query and you get the answer quickly.
Mm-hmm.
Special mention of Narsimha sir.
Mm-hmm.
Whatever I message him on WhatsApp, I get used to get answer immediately. And even
Mm-hmm.
Anup sir, I dropped queries sometimes. Being so busy, sometimes we are not so busy. Sometimes we also take time to reply to the messages. But I used to get the reply immediately, and that is very yeah, and that is very important for a newcomer.
Right.
Someone is there with you and someone experienced.
Right.
So
Yeah,
yes,
I think that's a
community forum.
very interesting point you have made, particularly where there is no person to person communication or person to person contact happening in a learning process. Having a excellent online support is something that is a must for anybody who wants to learn something new. And that is what I think DLife offers the best, uh, being an e-learning platform predominantly.
Yes. And
Definitely.
seeing such professional courses, there is a lot of
Mm.
competition kind of thing. Here,
Yeah,
people give their cases. You handle this, you handle this. So, this is really something great. So, it is not
yeah,
professional actually,
yeah.
completely professional. It is a blend of like professionalism,
Mm-hmm.
empathy, and somewhere the purpose to transform the health of the society,
Correct.
like disease to
Yeah,
health.
it's a big movement, as you rightly said, propelled to transform, failing metabolic health in India because of multiple fallacies and multiple misinformation being spread in the social media platforms. And I think D-Life is doing great job by spreading the right information through the large network of consultants that it has built and in process of building. So now that you are legally certified through D-Life, are you also handling clients? And do you think the course fees that you have paid are absolutely worth it?
Yes. Course fees is absolutely worth. I mean, it is less than what we get in T-Life.
Mm-hmm.
About cases handling, I was handling like after with Gopal's support, I was handling my mother's case. Then two, three more cases in family I was handling, and then I started step by step for my patients also, and patients gave me beautiful feedback. Like one of my patient used to like he used to get palpitations and sweating and restlessness at around 11, 12 in the morning, and he compulsorily used to have rest at that time, and this was happening since last 3 months. And I think in 3 months he took around 10 times his ECG with the fear that he's
Oh.
suffering from some disease, or he got angina or something like that. I just corrected his breakfast. And then
Mm-hmm.
he, after 15 days, he told me that now in 15 days, he didn't take help of any doctor because he didn't feel that uneasiness. He was completely all right, and he could carry his morning activities properly.
Mm-hmm.
So basically, it is unawareness and, as you rightly said, misinformation. मॉर्निंग में
Mm-hmm.
इतना खाना है, वो आफ्टरनून में इतना ही खाना है, फिर इवनिंग में स्नैक्स लेना है, फिर नाइट में ये लेना है, फिर सोने के टाइम पे वो लेना है. So all this is misinformation. As you
Right.
rightly said, we are not living to like to enjoy peacefully our life. but we are living to eat so that we can take medicines. Means something like that.
Yeah, people are all the time kept scared about don't eat this, don't eat that, don't eat fats, don't eat too much of protein, you will get kidney disease, you will get that. And that kind of thing is, just scaring people. And what people should actually be known about is don't eat too much of processed carbs or, too much of carb intensive food. And nobody talks about that. So I think D-Life is doing that great job, and you being a doctor talking the same thing. People have that trust with the doctor. So if the doctor is advising right things, then that can do really wonders to health of people. So excellent. And what would you like to tell to a prospective enrollee, you being a doctor? Uh, what your advice would definitely be heard by the doctors who are watching this podcast also. So what will you advise to them, anybody looking to enroll in this?
Yeah. Right now, to whoever comes in contact with me, like
Mhm.
students who are sitting with me in my consulting room, they are like, ma'am, this is something new which we are not taught, we are not knowing,
Mhm.
and we must learn. So, whoever comes in contact with me, be it my patients or be it my students, I keep on telling everyone that this you have to follow. And especially my students and my fellow doctors, I tell that you must join this to know something new. Make like to add something in your knowledge which will add the like health points
Mhm.
in your own life and in your family's life. At
Right.
least you join it for yourself and for your family. If you can treat them well, if you can bring reverse their diseases, then there is nothing like that. So
Yeah.
whoever comes to me, I
Mhm.
advise you now have to do something for D life with D
Yeah. Interestingly, the course actually stems from the basic physiology of human beings. So it is in alignment with the science that is taught to the MBBS students, and it is very much something that complements and therefore it gives a much bigger empowerment. Like in the initial talk, you rightly said that it has upgraded your basic
life.
knowledge base to a substantial level. So I think that's an excellent point that you have made for, I think, any prospective enrollee who happens to have a medical education also, that with this knowledge the practice will become more holistic and more caregiving, and that is what the basic purpose of any healthcare provider is.
Yes, basically this diet protocol facilitates medicines actually.
Mhm.
Whatever medicine we are giving, this diet protocol is removing all those obstacles
Right.
and clearing the system for medicine also to work in a better way. This is what
Yes.
I believe.
Yes. Excellent insights, Dr. Aparna. And you shared a very candid feedback about the course, and I think it will definitely benefit anybody who is considering to join D Life, as well as want to learn clinically interventive nutrition science. And thank you for joining me on this podcast today. I wish you all the best, and thanks a lot again. Thank you.
Thank you so much, Asmita. I always tell my students that when you will enter in practice, you
Mm-hmm.
will not only give medicines, you will have to give meditation,
Mm-hmm.
suggest meditation and nutrition to your students. So empower yourself with that along with medicines. Both of 5.5 years, may anyways you are going to learn, but add on something because this is the era of adding things. People see
Mm-hmm.
your this labels, what
Mm-hmm.
apart from your degree, what labels you have got, and then people will come to you, and this is the best label you can have
Yeah.
for your prosperous future.
Yeah, and once the patient is cured to the root, the happiness that the patient also gets, the part of it will definitely come to the doctor also as a satisfaction, because the basic purpose with which the consultation was offered
So
is
actually,
achieved. So,
And in
Great.
like homeopathy is like people come to homeopathy when they like try all other pathies. So anyway, the
Yes.
disease becomes chronic.
Right.
So anyways, we have to tell the patient that you have to wait for 6 months with
Hmm.
us. Gradually,
Hmm.
you will see improvement. So I feel if a homeopath, especially a homeopath, if he joins D Life along with the homeopathic medicines, if he prescribes D Life protocol, then within 6 months, definitely the patient will get cured only.
Excellent. Very true. Very true. Great. Great to have your feedback. And I wish you really the best in your consultation practice, as well as we are very happy to have an experienced person like you on the D Life community. We will grow stronger together.
Yeah.
Thank you,
Thank you
Aparna.
so much.
Thank you, Dr.
Yes, thank you,
Aparna.
Asmita.
Thanks a
Thank you,
lot.
D Life.
Yeah. Bye bye.
Bye.